Nothing under the bowl, nothing in the bowl besides the handy dandy supplies. Nothing, I don't even know if we can use this. I'm assuming we can't use it, so we'll just put that over there.
Alright.
We got our patient here, got the towel, which we don't need. Nothing under the arms, nothing under there. Nothing behind the IV pole.
Yeah.
Nothing on the IV pole. Nothing on me that I can really use. So let's start doing this blood. So the first thing we're gonna do, obviously, we're going to check the MAR, see that Betty Jones here is gonna get 1 unit of packed red blood cells. So then we're gonna get our supplies. So our Y tubing, normal saline, and our blood, and then our alcohol. So now we're going to meet our patient. So, hi Betty, my name is Zach, I'll be your nurse. And your hemoglobin was a little bit low in your labs. So we're going to, well I guess I should provide for privacy first, so we'll do that first. So provide for privacy, now we're going to explain the procedure. So, hey Betty, your hemoglobin was low, we're going to provide some blood for you. So we're going to verify her, so her name is Betty Jones. We're going to ask her for her birthday. She says May 21st, 1952, checks out. So then we're going to get our blood, and I'm going to have a second nurse, aka Kyle here, help me read off the blood. So the med record number is 224466.
Med record 224466.
Location is the HLRL.
Location HLRL.
Account number 123456.
Account number 123456.
Patient name is Betty Jones.
Patient name Betty Jones.
The red armband number is 456654.
Red armband number 456654.
Patient blood type is B positive.
Patient blood type B positive.
The donor pool number is 7890.
Donor pool number 7890.
Units in the pool 4.
Units in pool 4.
The volume is 250 mils.
Volume 250 milliliters.
The blood component is packed red blood cells.
Blood component packed red blood cells.
Expiration date and time is 12/22/2020 at 2000 hours.
Expiration date and time 12/22/2020, 2000 hours.
Donor blood type O positive.
Donor blood type O pos.
A compatibility test was completed.
Compatibility test completed.
And the date is 7/6/2020.
Date 7/6/2020.
All right, so now I'm gonna do my 5 checks. So we got Betty Jones, birthday 5/21/52. She's gonna get packed red blood cells, 1 unit, IV at 12:30. So Betty Jones, 5/21/52, 1 unit of packed red blood cells, IV at 12:30. Betty Jones, 5/21/52, getting 1 unit of packed red blood cells, IV at 12:30. We're also going to check the IV site, making sure that it's an 18 to 22 gauge, making sure that there's no bruising, it's not infiltrated. If it's saline lock, we'd flush it. Make sure that's good. And then we're gonna tell her, making sure that she's not feeling it, if she has any reaction to the blood, so a headache, back pain, chest pain, shortness of breath, or painful breathing, fever or chills, nausea, or any abnormal or unnatural feeling. All right. So now I would don my clean gloves, and we get this all set up. Grab our saline, make sure that all these are clamped. Clamp this thing, of course. Alright, now using the no touch technique, we're going to spike the bag. making sure that this isn't touching the channel. And then we're going to flush it through. Making sure there's no air bubbles in here. And now we'll put this over here. Clamp this. So now I'm going to take this and slowly invert it, checking it, making sure there's no clots, making sure the color's normal, making sure everything is all good with the blood. Once again, no touch technique. Make sure that's clamped. Alright. I'm not going to do it here, but if you wanted to, you could flush the blood all the way to the very end, so you don't have to sit when it's infusing in the patient. Next, we're going to clean the site. So for 15 to 20 seconds. And then letting that dry. Connecting it to the port. Picking red blood cells. So for the first 15 minutes, we're going to be doing 50 an hour for the rate. And since it's a 250 bag, we'll just do 200 for right now. So I'll show. And then we're going to start it, unclamp it. And now for I forgot to say, but we obviously get the baseline vitals beforehand. So now we're going to be checking on her, sitting with her for the first 15 minutes, getting her vital signs for 15 minutes. Then every 30 minutes we'll get her vital signs, every hour, and then after the blood's been put into her system, if she does have a reaction to the blood, we're going to stop it per protocol. So yeah, so if she has a reaction to the blood, we're going to stop the transfusion, report the reaction to the physician, notify the blood bank, complete this form. So obviously looking at time, maybe getting a blood sample, what caused, or like what reaction Miss Betty here reacted to with the blood, and then rechecking the donor. So after the 15 minutes, we can increase the rate from 50 to whatever Betty can tolerate. So obviously a lifespan consideration is older people, you might not be able to put it through as fast. So I don't really think I need to explain it, but we'd increase the rate. Once the blood's all the way through, we'd close this clamp, and then flush it with saline. And then once it's flushed with saline, we disconnect it and clean up our supplies, document it in the chart, and make sure Miss Betty here's doing all nice. Skip with the call button, Make sure she knows how to press the call button once we leave after the 15 minutes. And call it a day.